Hi, everyone. I know it's been a while since I first posted a couple of videos on the coronavirus back in May, and really just about everything that I talked about in that video or in those videos has happened. Although some of that stuff was already happening at the time. And this is the same thing that I'm doing with this video. This is really about the tales of the VID and the VAX. It's a shortened version of what I'm going to also publish, the long version that I put together a few days ago. But I wanted to be able to get this out in a way that more people would likely listen to the whole thing. So what I'm really trying to do right now is work to help humanity in general. Things that have been happening because of the VID and the VAX are very distressing. And that is not just to the human animal, the individuals that are being sickened because of the things and the responses to the VID, but also to the way that our society is now looking at each other and at the way that we are responding and being controlled by many different factions, including social media, general mass media, the governments, even the doctors' professions in organizations like the CDC and the World Health Organization, WHO. Everybody has a bias, and I'm not going to say that I don't. I do have a bias regarding this pandemic, because from the beginning, the numbers didn't make sense. They still don't make sense. But as I've done some additional research recently, I've recognized why there's a major difference between the flu and the VID, and it's got nothing to do with the virus. It's got to do with the reporting. So what I'm going to try to do here is provide some information to hopefully help you open your minds, provide some information that you don't normally see out on social media or the public mass media or coming from the governments or the doctors. But these are published on CDC websites, on the WHO website, and are recognized by professional organizations, but are just not receiving the same kind of publicity that you're getting on things that are more sensationalized regarding the virus. And because of the sensationalization, because of the indoctrination that people are getting through being constantly barraged by the bad part of this, and the way that the numbers are being used, people are more scared today than they've ever been regarding the VID. And they think that the VAX is going to be the lifesaver, and neither one of them are accurate when you actually take a look at what's gone on in the past and what's going on right now. So in my longer versions, I go into 5 different points regarding the VID and 5 different points regarding the VAX, but those are much more detailed, and that video takes a little bit more than an hour. This one I'm hoping to be able to keep within about 15 minutes. I want you to recognize that blindly following what you see and hear in mass media or from the government or so forth is not necessarily always the truth. And if it's not the truth, at least it's not the whole story. So you need to hear the rest of the story in order to be able to make more conscious decisions, logical decisions that you can choose then which direction to take based on having the whole story as opposed to part of the story. And lastly, keep in mind that many of the things that you see and hear from our governments, our politicians, mass media, etc., are driven by dollars and or control. Follow the money, follow who's gaining power, and you will learn more about why things are happening than just what you see and hear on the news. So One of the very biggest things that is different between the VID and the flu is the reporting requirements. So what I found is if you actually go out, and you can find this on the CDC website, the flu is not a required reportable event for anybody that's 18 or younger, or I should say under 18. So the mass part of our population is 18 and over, and there are not mandatory requirements of flu reporting or flu being identified as a contributing factor to deaths. And in fact, oftentimes the doctors don't even know that, because most people don't go to the hospital for the flu. Most people don't receive testing when they have the flu. In fact, if you think back just last year before the whole COVID thing, if you got the flu, what would you do? You'd take some aspirin, you'd take hot showers, you'd try to get some more sleep, you might call into work. And in a lot of cases, you didn't call into work, you went into work because you were toughing it out. It was just the flu, right? You weren't worried about dying. You weren't worried about what you've been hearing on the news, other than it's flu season and you need to wash your hands more. You need to, cough into your sleeve, that type of stuff, which is very important. I agree. But we did not freak out when flu season came around. And most of the time we toughed it out and never even went to the doctor. With COVID, it is mandatory to identify COVID as a contributing factor to any death, virtually any death that is recorded, and they can identify that there was COVID involved, and COVID stays resident in your system a little longer than the flu does. And COVID is something that people are going to get tested on whenever they feel like they're coughing or sick or have a fever. Again, not something that you would normally do during flu season. So the reporting requirements are a major reason why we're seeing so many more deaths attributed to COVID as a contributing factor, or as the reason people died, as opposed to the flu. And during the normal flu season, like in 2017 and 2018, between 46 and 95,000 people in the US alone died from the flu. This is on the CDC website. Now, these numbers aren't even finalized yet, because it takes the CDC somewhere between 2 and 3 years to figure out what the total numbers really are. But they're coming out and telling you that, up to 95,000 people with the limited reporting requirements of the normal flu, 95,000 people died in 2017, 2018. And guess what? During that same year, 150 million doses of flu vaccine were distributed during that same season. So how well did the flu vaccine really help in terms of controlling any kind of deaths from the flu? We don't know. And the CDC will tell you on their website that they don't know either. This is what people really need to understand, what you need to really understand in order to be able to put this COVID thing into perspective. The information that we received prior to this regarding the flu is definitely different, reported differently than COVID. If we reported the flu as a mandatory requirement for the entire spectrum of ages of anybody who died, we would likely see between 250 and 350,000 people a year die in the United States from the flu. Again, reporting is the key difference, one of the key differences between the flu and the COVID virus. Look it up. It's available to you. I'm just kind of giving you the shortened version because I did the research. The flu and COVID are spread the same way. They're spread through aerosolized particles that come out with your breath. And guess what? You need to breathe. You need to breathe deeply. In fact, 70% of the toxins in your body come out through your breath. So when you restrict your breath, when you breathe shallowly, which we do when we're more depressed, when we're not exercising, when we're not getting out of the house, when we're watching TV more, we're not breathing as much. So we're not allowing toxins to get out of our body the way that they normally would. This is a contributing factor to why the COVID virus is really affecting us more now than it did even at the beginning. And that is because we have reduced the effectiveness of our immune system. We have weakened our immune system because of the directions that we're following to control the virus, to control the spread of the virus. Now, think about that. If you went to a doctor before COVID and you asked them, what can I do to improve my health? They would tell you, get out and exercise, make sure that you're breathing right and breathing more, hydrate a lot, get sleep, get out and talk to people from a mental health standpoint, be around the people that are your support group, interact with people the way that you would normally want to interact. Those are the things that doctors would tell you to do in order to keep your immune system at its peak or as good as you can make it, depending on what you do. Those are exactly the opposite of what they're telling us to do to control the VID. Stay at home. Don't associate with your support groups. Cover your face with a mask so you don't breathe so much. You can't go out and exercise at the gyms the way that you used to. In fact, in a lot of cases, they're telling you even when you're outside, you shouldn't be exercising around other people or doing that type of stuff because you could be spreading or getting the VID. How can the doctor's directions change so dramatically in a year when in fact they know what is best for our general health, and yet they're telling us to do just the opposite in order to control the VID? So we've spent over 9 months now in this environment where we're not able to be around and do the things that we would normally do to help to improve our physical and our mental health. And when both our physical and mental strength come down, we weaken our immune system so that when we do get exposed to some sort of a disease, including COVID and the flu, but you'll find out that this year there won't be so much flu because they're going to say that the contributing factor was actually COVID to any kind of death as opposed to the flu. But please take a look at that and think about it yourself. Now you say, oh, but the mask is important and it stops the virus from spreading. No, it doesn't. Not the way that they originally tried to tell you or that they're telling you today. The VID is in aerosolized particles. Aerosolized means that it's very fine little particles that are included in the moisture and stuff that comes out in your breath. And you'll know that the mask doesn't stop that if you wear glasses and you go outside and it's colder outside and you breathe and your glasses get fogged up. Guess what that is? Aerosolized particles from your breath. Guess what's in the aerosolized particles? The virus, if you have the virus. Now, Mayo Clinic actually did a study on this. They put out some videos. They said, here is how the aerosolized particles actually work when you wear a mask. And granted, when you wear a mask, you cannot blow straight ahead and blow out a candle. Bill Nye, the science guy, showed that. But what they didn't show you, or what Bill didn't show you, the science guy, as he was ranting and raving about protecting his health, is that aerosolized particles escape through the sides of the mask, through the top of the mask, through the bottom of the mask, and even through the mask, but you can't blow directly through the mask. Think about it. If the mask really held all of these particles, all of these aerosolized particles, it would be like you're blowing into a balloon and the balloon kept expanding and then you're sucking it back in, expanding and sucking it back in. That doesn't happen. It escapes through the mask. It escapes through the sides, the tops, and even through the mask itself. If you have a self-contained unit, like you see some of the doctors in the hospitals where they're wearing a mask and a tank and so forth, that would be a different story. But that's not what we're being asked to do, and it's not what is really helping to control the virus the way that they try to tell you it is. So think about those things. Watch that video that Mayo Clinic put out and you'll see. And if you actually read about what they said in there, it says that yes, it stops the bigger droplets. The mask stops the bigger droplets. But even today, recently, they've been trying to tell you it's not the droplets that fall onto your tables or onto handles or your shopping carts that's affecting you. It is the aerosolized virus that is really spreading the virus. So why then are we seeing all of these people going to the hospital? Why are hospitals overflowing? Well, there's a number of reasons. Yes, the VID does have some strong side effects, but I've talked to a number of people that are relatively healthy to begin with and asked them, how is the VID compared to, say, a bad flu? And they say, oh, it's a 2 or a 5. I've had a lot worse flus in the past. In fact, me personally, I've had times when the flu would affect me for 6-8 weeks. I would be coughing for, actually, I've had times where I was coughing over a course of 3 months, and I go to the doctor and they tell me, oh, you have a chronic cough. Now they would tell me something like, well, maybe it's because you had the VID. They don't know, even because that when they do the test for the VID, they're testing for antibodies for the virus, but that doesn't encompass all of your body's immune system. Your body has T cells, C cells, and many other ways that it actually helps keeps viruses and disease from getting into your body. And those things are not being tested. So you're only getting part of the story when you do get a test for the VID. Now, why are hospitals overflowing? Going back to that. When people are scared that they're going to die from the virus, and I've talked to a number of people and listened to people talk that if I get the virus, I'm going to die. So they immediately go to the hospital. And when they get to the hospital, they're scared. And it's a legitimate scare, a scare that has been ingrained or imposed upon us by the media and so forth. And as a result, when they go to the hospital, if they have been experiencing things, they tend to also experience them or relate them in a more strong perspective. They are scared. They want to be admitted into the hospital because they think that if they don't get admitted, they're more likely to die. They're more likely to get worse than if they were to go home. Now, doctors, on the other hand, also are afraid, but they're afraid because of what they're hearing through their means, but also because there's a liability issue that if they were to release people from the hospital or not admit them, that there's a chance that there's some sort of libel suit that lawyers are out there right now putting together to be able to try and sue and get money for against doctors and hospitals that turned away people that may eventually have gotten worse or possibly died. These are two ways that are really adding to the number of people that are being admitted to the hospital and that are going to the hospital. If it was just the flu season, a lot of these people wouldn't go to the hospital. Many of them would still die, but it wouldn't be attributed to the flu. Now, the vaccines, and especially like the flu vaccine, as I related earlier, don't really work like something that's going to save humanity, like they're trying to make this COVID vaccine out to be. 150 million doses of the flu vaccine are administered in the United States approximately every year. It's been going up, and actually there's been kind of a simultaneous trend of the flu actually going up, flu deaths going up in the United States. So are the vaccines really doing a whole lot for people's health? I question that. I'm not going to say one way or another, but I would say that you have to look at the fact that more vaccines are being administered every year, and yet it's not really dramatically reducing. And in some cases, if you look at the trends, they're increasing the number of people that are dying or being affected by the flu. And when I talk about being affected by the flu, there was an estimate that some 45 million people to maybe 58 million people in the US had the flu in the same 2017, 2018 season. So millions of people get the flu. Millions of people have gotten the VID and not died. In fact, 99.9% of the people that get the VID do not die. So mass media loves to focus on and sensationalize the things that scare people, because that draws people in to watch tomorrow and watch tomorrow. Give me the numbers for tomorrow. If they said, oh, another 100,000 people just survived the VID and another 100,000 people survived the VID, people are going to be like, yeah, okay, so why am I watching this? Because people are surviving. People survive most of the time. So it doesn't draw the attention. And that's what news media is trying to do. In fact, that's what really the CDC and the WHO are trying to do. Remember, they are funded by governments. And in order to get funded, you also have to be able to show value. Now, if they come out at the end of this and start saying, we really kind of screwed up in what we said to do, and that, the vaccine really isn't doing exactly what we said it was going to do, then there would be a question on the value that they provide. And I'm not saying that they don't provide a value. I'm just saying that they're using different means in order to be able to make sure that they can justify their existence in the way that it is. I know you're going to say, well, Brett, you've really, gone over the side on that one. And yes and no. I need to be able to bring your attention to the fact that there are alternative reasons why different organizations, why the governors love this fact that they can now control their states far more than they did before, why governments can shut down and lock up people and take people's livelihoods away from them at their whim. That's kind of scary. And people now are really experiencing death through 1,000 paper cuts or death through 1,000,000 paper cuts. Every time you hear about a limitation or some kind of a restriction put on, they tell you, oh, it's going to be for like a week or 2 weeks. And then that 2 weeks come up and it's like, oh, it's going to be another 2 weeks. Oh, it's going to be another 2 weeks. Well, those first few weeks or that they put these restrictions on us back in March timeframe have now extended into January the following year. And guess what? The initial report that talked about, how the virus was going to flatten the curve and then it was going to go back up toward the end of this year or last year. Guess what? That's exactly what it did, but it was exacerbated by the fact that we did things and were directed to do things that actually reduced or weakened our immune system. Therefore, now we're seeing probably a bigger peak than we would have seen had we just allowed things to happen without as many restrictions as they put on us. So another thing to bring out about vaccines is that there's really only two diseases that have ever been eradicated by vaccines. One, the smallpox, and the other called rinderpest, which has caused deaths of cows. Now, there's a couple other diseases that seem to be getting a little bit more under control, like the measles or polio or rubella. But in fact, vaccines are not necessarily the best way to be able to control a virus. As people get exposed to diseases like the flu, like COVID, they build up natural immunities. You've heard this in the term herd immunity. When we get to 60, 70% of the population having been exposed to the flu or the VID, and if the body's immune system actually works, the next time the flu or the VID come around, it will have a far less impactful effect on the population because the population has already been exposed. exposed naturally to the VID. What they're going to try and say is because they got this vaccine out, that is why next year it may not be as impactful. The VID may not be as impactful as it is this year. The vaccine did this. The vaccine did that. Well, they're hedging their bets now. Why? Because they're seeing these mutations of the VID that are coming out. And now they're saying, oh gosh, you know what? We're not sure that the VAX is going to work against these new strains of the VID. And these new strains of the VID have already spread. By the time they figure out that the VID has changed, it's already spread because it's got to go out to a number of people before they actually do identify that there's a new strain of it. And there's at least 2 to 3 new strains that we know of. And they're not sure how the vaccine is actually going to work on it. They're saying, yeah, it should. Or Dr. Fauci just was saying, well, we're very good at being able to manipulate this new vaccine process so that we can address new strains of the VID that might come out. Horse crap. What they're really doing is they're saying, we're not sure that the vaccine is going to work, even though we're trying to tell you that it's 90% effective. And the reason it might not work is because there's new strains, and those new strains weren't addressed in the original formula of the VID that went out. Well, sorry, but I just told you that 150 million doses of the flu vaccine go out every year, and yet still 46 to 95,000 people died in the US with a reporting process that is significantly different than what's required for the VID. So why am I bringing, again, all this stuff out to you? I'm bringing it out because I do have a genuine concern for you and your family. And I think that it's very important that you have the rest of the story in order to be able to make a conscious, logical decision for you and your family and those around you. So please, if you have any questions or you want to see more of the detail, and I do provide some of the references in my longer video, please take a look at my longer video. In the meantime, I hope this has been very helpful to you. I know it extended longer than I had anticipated, but I really do get passionate about this. And I'm not trying to say that our medical community or the WHO or the CDC or the governments are intentionally necessarily doing something that they know is wrong, but they don't know that it's right. And they're only presenting part of the story through the mass media and general social media and through the governments, when you can go to their very specific websites and find this information that I just related to you today. So I thank you very much for listening. I hope this has been helpful. Again, I really do wish the best for you and your family, and I hope that this information helped. In the meantime, stay healthy, breathe deeply, get out and exercise, hydrate, take those vitamins like vitamin D and things like that to help your body to rebuild the immune system that you have likely weakened over the past 9 months as you have been scared, and mental health and depression weaken your physical immune system, and not exercising, not breathing, not eating properly also reduce or weaken your immune system. Thank you very much. I wish the best for you. I wish the best for humanity. And I just hope that this provides a bit of the other side of the story that you don't normally hear through what you see and hear on TV or on social media. Thank you very much. Have an awesome day. I wish the best for you. Take care.